Happy Wednesday Wellness, everybody! Is this our first one of the new year?
Yeah.
We fell off a little bit.
Yeah, it's been busy.
It's been busy.
It's been snowy.
Snowy and
Just illness and just a lot.
Yeah.
January 2026 came out with a bang.
I know.
Here in
truly.
Michigan.
Yeah, what a wild ride we've been on so far.
Yeah, so here we're back.
We're back
with all of our educational videos.
We're talking about things again today. What are we talking about today,
We're
Rich?
talking about pregnancy and the Webster Technique.
Yay!
Congrats, you're pregnant.
Woohoo!
Now what?
What do you do now?
Who do you want on your pregnancy team?
Yes, those are good things to think about. Like, do you want a midwife or an OB? Do you want a doula on your team? Do you want...
birth classes, pelvic floor PT, prenatal chiropractors? You do.
You do.
You want us.
Yeah.
And we're gonna tell you why.
We're gonna tell you why.
Yeah.
So Dr. Rachel and I are both specialized in a specialized technique called Webster Technique. Some people have heard about it and have no idea what it is.
Yeah, we'll get phone calls like, hey, are they
pregnancy.
Webster certified? Yeah, we are. But I bet no one actually knows what that means.
Yeah.
They just know you should see, and you should, if you're pregnant, see a Webster certified chiropractor.
Yes, exactly. Yep, because they are trained in more pregnancy stuff.
Yes.
And Webster Technique, sometimes people think it has to do with turning babies, which is also incorrect. But what we do is we help open up mom's pelvis, make sure everything's in good alignment, give baby the most amount of optimal room so that they can get themselves hopefully into that head down position.
Right.
If it doesn't work like that, usually there's other factors. It could be anatomical, it could be nuchal cord, there's other things that could be preventing that.
You're right. So people think like, oh, my baby's breech, I'll go see a chiropractor, Webster certified. But we help throughout all of pregnancy. We're like, making sure pelvis, body is balanced. Just so you have a better pregnancy, right? Like you're more comfortable, but also an easier labor delivery.
Yes, exactly.
Which then hopefully has happier baby.
Yes. Happier baby, happier mom, easier recovery.
Yes.
All those things. So we want for that beautiful birth.
Yeah.
And then, so Webster Technique is like a technique that was designed, there's like an analysis and then adjusting technique that's looking at the pelvis and how the pelvis is able to move, how it's able to open up, and just making sure that it's in balance there. Because if everything's in balance, we have this beautiful round opening for baby to come through. Sacrum kicks back during labor, and so the hip bone's open, giving space for baby to come through. But what happens is if we have like imbalances from injuries or crossing our legs the same way every time, or
just stresses.
I mean,
like honestly, you're growing a baby. There's your center of gravity changes. Muscles are working different to keep you in an upright position. Maybe we have old injuries in our pelvis that are now going to re-show because we have relaxin in our body.
Or pelvic floor weakness or tightness too. That's all going to change how the pelvis is able to move during that pregnancy, during that labor, and then it's also going to affect like the shape of that opening too. Like you can see if we have a distortion in the pelvis, that's going to make it harder for a baby to get through there. And also your uterus sits in here too. Your uterus has uterosacral ligaments that attach to the sacrum. Your round ligaments go right in front of the pubic bone here.
Yeah, so this is front of pelvis,
this
is back.
And those are like suspensory ligaments too. So if your pelvis is torqued like this, your uterus is also going to be torqued, which means baby's not going to have as much room to get into that good position too.
Right. And remember, should we talk about the 3 Ps?
Sure.
I mean, if we want to. I don't know.
Yeah.
Like what?
So Webster, I'm
like, I don't know. Do we want to, how much do we want to get into this?
3 Ps. Why not? Yeah. That's what Webster Technique is. So Webster Technique really addresses what we call the 3 Ps. It's power, passage, and passenger. So those are the 3 factors when it comes to dystocia. This is what
dystocia, difficult labor.
Yes.
Labor that's not progressing. That's what dystocia is.
Exactly. So difficulty during that labor process. So power is how our brain is able to communicate with those muscles, how those muscles are contracting, and that's the power, the expulsive forces. So our contractions, how everything is contracting together, how things are opening up together, that's the power, right?
Brain communicating with body, what we talk about with our chiropractic care in general, nervous system.
Yes,
so
exactly.
Yes, we're focused on the pelvis, but we're focused on your whole nervous system because that is important not only for growth of baby, but for labor delivery.
Yeah, so why not see a neurofunctional chiropractor that's also certified in Webster Technique?
Yeah.
Boom. Should have kept those sunglasses.
Yeah.
So power, number 1. Passage is that round opening.
This is what you think of probably when we talk about it. Like we just talked about.
Yes.
The round opening.
Passage is how baby's going to come out of there.
Yeah.
And then passenger is baby. So how well baby's able to get into that head down position, getting their chin tucked, head in line with the
cervix.
It's
how how your cervix dilates.
Exactly.
So you want baby in good position. This is always weird when I use my fist genius for this, but like if you want baby like nice and center, not coming down on an angle.
Yes.
Because then baby's head isn't pushing on cervix, right? Like the
Yep.
cervix is gonna dilate from baby's head being nice and centered, right?
Exactly,
That's how
yep.
dilation is happening. Also, why baby should be checked because their head is pounding against the cervix,
Mm-hmm.
and then being delivered. But yeah, so baby's at an angle. Because pelvis is all wonky.
Yeah.
Muscles are tight on one side.
So if you hear about like, my cervix only got to like a 3 and then I was stalled, or my cervix only got to like an 8 or 9 and then I had to get Pitocin because like my cervix wasn't dilated, usually it's because of that, like baby's kind of ready to go, your body's trying to open up and get things, but maybe they're not lined up exactly right.
So that's how we also, like, we're not turning baby, but yes, we're getting pelvis aligned. Like, so we work on the psoas muscles, we work on the round ligaments, we work on piriformis muscles, get everything to relax nice and balanced so baby can get in that really nice position.
Yes,
For
exactly.
labor delivery.
Which
Easy.
makes it more comfortable for you too during your pregnancy too, because then baby's able to like line up with how your anatomy works also. Like we want them in that head down position. It puts a little pressure on the bladder, but not as much as feet punching you. And it's just like more comfortable for
This is also how we can help with the breech baby though.
Yes.
Is because we're giving baby space to get down in that head down position.
Exactly.
But we hear all the time people that maybe we didn't see during the first pregnancy, we see during the second, like, wow, this pregnancy was so much easier.
Yes.
Or maybe they start later in pregnancy and they're like, wow, this second half of my pregnancy is much easier than my first. Like, I feel way better. Like, oh, I should have started this earlier. So it's never too early to start. I feel like we get that question a lot. Like, when should you see a chiropractor?
Yeah, I mean,
We see people that, as soon as they know.
Yeah,
right?
we see people like even when they're trying to get pregnant too. Like that preconception time is really important, especially if you're dealing with a lot of stress or holding a lot of stress in your body. A lot of times that like getting pregnant process takes a lot of stress and like takes
a lot of
toll on your
worry,
body.
anxiety if it's hard.
Yeah.
So
exactly.
So
that's a good time to get your nervous system regulated, which helps everything else kind of fall into line then too.
which we do.
Yeah. But no matter if you're pregnant now and you're like, I only have a couple weeks, we'll still
Great.
see you. It's still going to be better than.
Still gonna help you get everything aligned for probably be more comfortable than you would imagine.
Yes, exactly. Yeah. Sleep better.
Sleep better. Yeah. So if you're watching this, like, oh my gosh, I'm pregnant. You're right. I've been thinking about this. I want to do this. You can comment below pregnancy.
Yeah. And we'll send you.
Yeah, we'll send you. You'll get a link to schedule. You'll get a link to schedule, and then make in that link say, hey, I saw this video. I scheduled off this video, and you'll get a discount for your new patient exam.
Yep.
Okay. Enjoy the weather. Stay warm out
Enjoy
there.
the snow days.
Yeah. Enjoy the snow days with your children at home.
Yes.
Have a great day.
Bye.